Yeah, respected chairpersons. So best wishes from the team are you to one of the star-studded team of the Netralayam. Many congratulations for this wonderful organization. So I'll be talking on phacoemulsification in small pupil, which is odd man out in the glaucoma session. However, if I do create some complications, the patient is going to go your way. So I'll be talking on phacoemulsification in small pupil, no financial disclosures to be made. So what is the magnitude? 4 to 12% of the cataract cases can have a small pupil, and the patients with or who are on blockers for the BPH, they are more prone for IFIS. So a large percentage of the patients can have floppy iris syndrome, and these are the patients who can give a lot of headache during the surgical procedure itself. So critical diameter for people to be considered, for me it is around 4 to 4.5 millimeter, but some expert surgeons still do around 3 millimeter. But remember one thing, that pupil size is relative to surgeon's skill and technique. You have to identify what is your skill level, and then accordingly you have to move. Intraoperative situations, what is happening in between the surgery, and finally the iris tissue property, which is very important in the pre-operative phase, which need to be identified, the pupillary dilatation and the properties of the iris. If the iris texture looks like a weakened one, these are the patients who are actually ready for some kind of devices, rather than just working on and then creating some sort of complications. So remember the causes. Some of the important causes, you all know, the pseudoexfoliation and the medical conditions like diabetes, past meiotic use, and IFIS we have already talked. So what are the challenges? The challenges are reduced red reflex will be there, increased risk of iris damage, iris bleeding, iris prolapse, small anterior capsular excess, incomplete evacuations of the cortical metal, problems in ensuring the in the bag IUL placement, and proper alignment if you are doing a toric IUL. So any sort of complications can occur while managing a small pupil case. So impact of small pupil can be devastating, starting from just a small iris chafing to a lot of edema, which can go into PBK side, and to a drop of nucleus if you are not planned properly. So proper pre-op evaluation and the proper planning can safeguard you. So in my personal choice, I usually go little anterior into the anterior limbal, so that I am on the top of the nucleus rather than on the posterior side, so that my reach is little more, and I stay anterior. So high molecular viscoelastic is also very important, and endocapsular vertical chopping phaco technique should be utilized for these kind of the cases. So the current approaches are the pharmacological, now newer drugs are available, and the surgical techniques, there are a few techniques which one has to master if you are dealing with small pupil cases, like saniculisis, iris stitching, iris cutting, iris retaining devices. So one should be master of all these techniques if they want to deal with the small pupil cases. So the pharmacological, I'll not go into the details. Now newer medications are available. Without taking name, they are also helpful. However, in some of the cases, one has to remember that if you are using many chemical agents, one can create a task-like situation on the next post-operative day. So preferably try not to do that. So the first indication for utilizing the device is when I'm just going inside and seeing the pupil. So if this is like a breathing pupil is there, so you can see the breathing of the pupil. So I usually get alerted if that this pupil might fall during the surgery, and I usually have the second plan ready for myself. So use viscoadaptive OVDs, decrease fluidic parameters, manipulate in the pupillary center. That is also very important if you are doing a small pupil surgeries. So these are some of the methods which we can be utilizing during the surgical manipulation of the iris, and then creating a space for doing phacoemulsification. So in iris pupil stretching, you can use two wide dialers to create 100 stretching on the two side, 180-degree apart, and this is going to give you some kind of 5.5 millimeter of the pupillary diameter, and you can do a safe surgery. Usually these are the rigid pupils where we are doing this, and this will give you a good space to do phacoemulsification in these kind of cases. But remember, Don't try these in iris or iridocytis where the iris is not of good texture. So if you do that, the stretching, then there can be a lot of problems. So iris cutting can be also be done. Then iris retaining devices are there which we can utilize, like iris hooks, where you can use 3 or 4 iris hooks for your dilatation of the pupil. In the diamond shaped, so this is going to give around 5 to 5.5 millimeter of diameter of the dilatation, and we can do a safe eco-emulsification. And then finally, we have iris retaining devices, and not to go into the detail, but this devices has changed our outlook for utilizing the device from this city only. So BHEX is a very helpful kind of device with 6 flanges and 6 notches in a uniplanar fashion. It goes nicely from a small side port also, and then you can create a very good, this side port entry can be done, and then through the side port you can use the BHEX device to get a pupillary dilatation of about 5 to 5.5 millimeter. So these are some of the very important way of dealing with the small pupil devices. Now, important thing is to remember, to conclude with, follow a stepwise approach, always give importance to the size of the pupil, biomechanical properties of the iris, prepare your patient mentally for prolonged surgical time. This is also very important. We need to talk to the patient. Stay in the center, don't try to foray into a blind space. Reduce the number of entry and exit. This is also very important. The number of time you do enter into the anterior chamber or make an exit, you are likely to hit the iris, and the more you hit the iris, they are more likely that this can create a lot of problems. So modulate your technique and try to avoid touching the iris as far as possible, and try not to do a blind procedures. Thank you for your kind attention. And please do join us in Glaucopad, that is on 2nd, 3rd and 4th of October. GSI secretary is there. So I do invite everyone to Patna for this mega conference on glaucoma by Glaucoma Society of India. Thank you very much, Team Netralyam, for giving me the opportunity. Love, Manish, everyone. Thank you.